Good evening. My name is Meredith Cadaba, and I'm a senior at UNC Chapel Hill.
Hi, my name is Sam Mazio, and I'm a junior at Duke, and we'd like to welcome you to our Tobacco Road Veritas Forum.
Veritas is Latin for truth, and we want to seek truth together as we discuss complex questions and explore our beliefs. We want to thank you for joining us this evening as we come together to consider how we may find peace in our anxious moment. Over the past few weeks, we've all been navigating this new way of life, and initially the physical implications of this time were at the forefront of my thoughts. However, I'm realizing that it's nearly impossible to parse out the physical effects of this situation from the emotional and mental effects of our health and well-being. I've personally experienced a wide range of emotions over the past few weeks and have tried to give myself grace to accept a nonlinear path of processing during this time. And despite the rivalry of shades of blue, we know that this topic is extremely relevant to both UNC and Duke students right now. Our hope for tonight is to foster a culture of honest consideration and exploration for both campuses and other listeners. And now I'll hand it over to Sam, who will introduce our panelists for tonight.
First, I'd like to introduce Dr. Warren Kinghorn.
Hey everyone, thanks for having me tonight.
We're really happy to have you here tonight. Dr. Kinghorn is a psychiatrist and theologian on the faculties of Duke University School of Medicine and Duke Divinity School, where he co-directs the Theology, Medicine, and Culture Initiative. His work centers on the role of religious communities in caring for persons with mental health problems, and on ways in which Christians engage in practices of modern healthcare. Next, I'd like to introduce Dr. Nii Addy.
Hello, it's great to be here. Thanks for having me.
We're really glad to have you join us. Dr. Nii Addy is an associate professor of psychiatry and of cellular and molecular physiology at the Yale School of Medicine. At Yale, Dr. Addy directs a federally funded research program investigating the neurobiological bases of substance abuse, depression, and anxiety. Dr. Addy has also built unique partnerships between scientists, clinicians, professional athletes, faith leaders, and community groups to address issues at the intersection of mental health, faith, culture, and neuroscience. And finally, I'd like to introduce our moderator tonight, Dr. Michelle Kirtley.
Hi, happy to be with you.
Thanks for joining us tonight. Dr. Kirtley serves as Vice Chair of the Board of Samaritan Health Center, a private Christian health clinic for low-income and uninsured residents of the Research Triangle. She is also a fellow with the Center for Public Justice, a faith and public policy organization in Washington, D.C., and she teaches from time to time in the Masters of Bioethics program at Trinity International University in Chicago. And now I'll let Dr. Kirtley take over.
Thank you, and thanks to both Warren and Nii for joining us and taking the time tonight. I know, just for me personally, the number of times that these kinds of questions and issues have come up over the last few weeks have been more than I can count. So I know our audience really appreciates your time. Maybe we can start tonight by having each of you tell us a little bit about your own vocational background, and then how the pandemic is affecting you, both in your vocation and personally, how you've been experiencing things lately. Warren, you want to start?
Sure, happy to. And it's so great to be here with all of you on the call and with Dr. Kirtley and Dr. Addy, whose work I've respected for a long time. So this is really fun. I am local to the Triangle, and so I teach at Duke University Divinity School, where I co-direct the Theology, Medicine, and Culture Initiative. And I'm also a psychiatrist, and I am a psychiatrist at the Durham VA Medical Center, where I was all day today working in the emergency department, and then also work a lot with the psychiatry residents and medical students at Duke University Medical Center. So that's kind of the different ways that I spend my time during the week. Michelle, did you ask like how COVID has affected us so far?
Yes, exactly.
Yeah, I mean, I think that in many ways, I think COVID is affecting all of us in every way. And so that's certainly the case for me. So, I mean, as a parent of a 14-year-old daughter and a 9-year-old son, and my wife and I are having to figure out how to manage schoolwork and manage family life when there's when we're home more than we were before, and as a teacher at Duke, I'm just like all of the students that are on the call, I'm having to figure out how to transition learning to Zoom and really missing the chance to have end of year rituals and to have a proper way to say in person farewell to a really fantastic group of students that we've had this year in our theology, medicine, and culture program and at the Divinity School. And so I'm missing that. And then as a clinician, it's been, I think I'm really looking forward to hearing Nii's experience in New York. I mean, around here, as most of you know, we've been intensely preparing for a surge of COVID in our local hospitals. But so far, we've had an increasing number of cases, but nowhere near the kind of capacity surge that have been seen in New York and Italy and elsewhere. So it's been a combination of actually, in some ways, less intense volume in most of the clinical services, but intense information overload and like preparing for the contingencies, and a lot of anxiety among both staff and clinicians, but also the patients that I work with are anxious about getting infected, about losing their jobs, about losing their livelihoods, about losing family members. So I'm feeling it in lots of different ways.
Nii?
Well, thanks so much for that, Warren, and just for giving us the context as well. I think that's really important for us, all of us, to be able to consider how this affects all of us. I will say also at the onset that I do have ties to both UNC and Duke, so it's really a joy to be able to see the two schools come together for this forum tonight. And for me, as was mentioned in the introduction, I run a basic research lab at the Yale School of Medicine. And so on a day-to-day basis, what we're focused on is really trying to understand what's happening in the brain during different mental health states. So depression, anxiety, substance abuse. But as was also mentioned, we do have a lot of initiatives that have focused on public-facing conversations. So trying to think about the many different aspects to contribute to our mental health. And in that vein, I've been on sabbatical since September, and as Warren alluded to, spending time in New York City in particular. So during that time, I've been spending time both at Montefiore Hospital, which is the hospital associated with the Albert Einstein College of Medicine, and at Weill Cornell Medical Center, both in Manhattan and the Bronx. So in terms of how COVID has impacted things on a day-to-day basis, the work I'm doing with Montefiore in particular is with the clinical psychology interns there. So I'm participating in a lot of the didactics and their sharing, and we're just thinking about different ways to perform therapy. But I know for them in particular, this has had direct impact on their day-to-day interactions with their clients, as this is something that's on a lot of minds of their clients. A lot of the folks in this internship are working in some underserved areas, and so there are additional challenges that come along with that. But just trying to figure out how to navigate this for their clients, even as they themselves are also going through what they're going through and responding to COVID and living in New York City. So practically all of my work has shifted to remote work, but I've still kept in touch with my colleagues. I know there have been times when people have felt stretched very thin with the hospitals being almost at full capacity. That fortunately has gotten better over the last week or so, but there are still a lot of people who are getting sick, and that takes an emotional toll on people, and also takes an emotional toll on the frontline workers. So I'd say in a lot of ways, there's been a somber atmosphere just with everything that they've been trying to deal with there.
Sure. Well, when we think about these kinds of issues, anxiety, depression, all sorts of experiences that people are having, Nii, maybe you can help us understand a little bit with your background as a neuroscientist. How does that work out in our brains? What's going on in our brains when we experience these things and we don't feel or respond the way we think we should?
That's a really great question. So one thing I would say, even at the onset, and Warren started to allude to this already, but this is something that's completely normal for us to feel. So I think that's something that we should make clear at the beginning. This is the way that our brains were designed, and this is the way that we cope with things that are challenging that come up in our environment. So I was participating in a session with a pastor last week who was also asking some similar questions, and he shared what I thought was a really helpful anecdote. So he talked about a specific instance where he had gotten onto an elevator and all of a sudden felt this feeling of panic, like he just needed to run off the elevator. He was worried maybe the elevator was going to crash or something like that. He just couldn't kind of control his emotions in that moment and wanted to run out of there. So we talked about the fact that those are parts of our brain, like the amygdala, that are highly responsive to a hormone called cortisol that gets elevated when we're in a stressful or an anxious situation. But we also talked about how that can happen in different scenarios. So what I described to him is, even though in that scenario, he didn't need to be panicked about the elevator itself, but in a different scenario, you can imagine if he were walking across the street and a car was coming and about to hit him, that's the exact type of response that he would need to have to get to safety and not lose his life. So a lot of times it's how our body and how our brain is reacting to specific situations. We have challenges when that response becomes more heightened than it needs to be in a specific situation. I would say with everything that's happening with COVID, this is something that's very unique for us as a society. To see something on this scale is something that not many of us or any of us have really experienced. There are definitely areas of the world that have experienced this type of thing before, but perhaps not on this global level. So a lot of what's happening in our brains is the way that our brains were designed to respond to challenges. The challenging thing for us is there can be long-term consequences of that. So when we think about depression, there are a lot of hypotheses about things that happen that lead to depression, but there's also a lot of evidence there are lots of changes that in the brain that happen with long-term stress exposure. So changes to brain function, changes to brain structure, changes to brain activity, and likely all those things are contributing to our anxious and depressive responses in these situations.
So probably to varying degrees, all of us have elevated levels of cortisol to some degree or another, and then people are in particular situations where that may be heightened because of the individual ways that they're experiencing this pandemic. And how does that work out with specific conditions like that it may be pre-existing, like depression or anxiety that was, let's say, diagnosed even before this happened? How do those elevated cortisol levels and that kind of stress affect those kinds of conditions?
Yeah, so you've asked a really great question and a very important point as well. So especially for people who are already dealing with mental health challenges before COVID, unfortunately, this can really exacerbate some of those things. So one of the things we've been trying to think about in terms of being in contact with people is also paying attention to those things so that there isn't a rebound of even more mental health challenges after some of the infection rates have started to go down. But to your question, those things, if someone has a predisposition, either because of a trauma they've been through or a certain experience they've been through, or because of biological or hereditary susceptibility, sometimes that elevation in cortisol can make that person more susceptible. So there are specific areas of the brain that can regulate our response, regulate how much cortisol is released and how we respond to those situations. But if we're already in a state of depression or a state of anxiety, that regulation can be less and can make someone even more susceptible to those types of responses.
Well, Warren, maybe then as a psychiatrist, you can familiarize us with what those range of effects might be that you might see either in the clinic or just maybe even before someone gets to the clinic.
Yeah, thank you. Yeah, I mean, I'm really looking forward to this conversation with Nii about how to put all this together. That I think just maybe speaking first to the experience of students, I think, because a lot of us on this conference are students or involved in universities, and I think it's important first to know that apart from COVID and before COVID, that mental health challenges are and were and still are incredibly common among not only Americans as a whole, but maybe among college students in particular. There's a national survey that comes out a couple of times a year that I know that Duke is a participant of. I'm not sure about UNC, but it's called the National College Health Assessment. And this is always something I think about when I think about being a teacher in a university. That in 2019, so this past year, this is a study that's been done year after year for the last 10 or 20 years, 72% of college women and 51% of college men reported that they'd felt overwhelming anxiety in the last 12 months.
Wow.
And that's actually up from 53% of women and 38% of men 10 years ago in 2009. And 48% of women and 37% of men said that they had felt, quote, so depressed that it was difficult to function in the last 12 months. And that was also up like 10 percentage points from 2009.
Wow.
So this is incredibly common. This is happening at Duke, it's happening at UNC, it's happening at institutions all over the country where college mental health services are really overwhelmed and there's really significant challenges. And one of the things that I think we want to say multiple times tonight is if that is you, you do not have to live with this alone or suffer alone or be alone. There's support. both from the campus mental health services at Duke and UNC, and also from others, and we'll be talking about that. But mental health is just an incredible challenge on college campuses more broadly. And COVID has just like put an acceleration on all of that. It's a little too early to know like exactly what the mental health effect is of COVID, but there's some early data. The company Express Scripts just put out a report last week. That's a thing that they do from time to time. And they reported that between mid-February and mid-March of this year, so right as COVID was kind of really entering everyone's consciousness in the United States at least, there was a 34% increase nationwide in filled prescriptions for benzodiazepines, which are common anxiety-reducing medication, in 1 month. And that's actually been going down actually for the last 5 years gradually. There was a 19% increase in antidepressant prescriptions. There was a 15% increase in sleep medicine prescriptions. Now, some of this may have been people just trying to get their medication early before we went into lockdown. That's possible, but it certainly signals that a lot of people were feeling unsettled and anxious. And that, I think, is what I see in my patients. It's what I feel in myself. It's what I see in my students. And it's what probably a lot of us on this call are experiencing. I think just a few things that might be going on with that. If you're feeling anxious or depressed or stressed, just as Nii says, it is okay to feel that way. This is an incredibly stressful time for a lot of people. And it's also hitting some people in disproportionate ways. But, you know, there's anxiety about contagion and about the health of loved ones. There's economic anxiety. So some of you on this call have families or parents or siblings, or you yourselves are at risk of losing jobs or livelihoods. There's the anxiety of feeling just out of control about how the pandemic is being handled by various authorities and seeing disagreement in that way. There's social isolation and loneliness, both of which we know are toxic to both mental health and health more broadly. And then I often think with respect to students, like when everybody goes home from campus, for some of you on this call, at home is a really great, safe place to be. It's a place where you're loved, and that is really wonderful. And for some of you, home is a really hard place to be because of things that have happened at home and are still happening at home in terms of relationships and what's happening there. And so I think just being able to say, if we're feeling anxious and we're feeling stressed, that is okay. I also think beyond college students, it's really important to recognize that certain segments of our population in the United States are getting hit disproportionately to others. And so there's now this really alarming data from multiple areas that Black Americans are getting disproportionately hit, both with the medical effects of COVID in terms of severe illness, but also the economic effects and devastation of COVID. And there's some also some stories coming out of Native American communities and others. And so unfortunately, the pandemic is increasing the vulnerability of people that were already, for social reasons and economic reasons and historic reasons, vulnerable. And that's something that I think also can be connected to stress and anxiety that intensifies prior stress that had gone on. I think regardless of the reasons, though, I think we should know that there is help and there's support available. So none of us have to go through this alone.
Thank you. Well, on that note, I know that kind of the combination that we've talked about tonight, understanding in detail, and if we had a lot longer, I know that Nii, there's a lot more you could have unpacked for us about how our brain functions in all of these different scenarios, that understanding that can be really helpful for people to say, it is okay, this is biological. But at the same time, it can leave patients feeling a little less optimistic because it's biological. Can it be fixed if this is how my brain works? And Warren, you were talking about great avenues for support and the kind of help that there is. What support and help should people be looking for if they're struggling with these kinds of issues?
Yeah, I think, you know, I think the main, well, first of all, I think I think thinking with Nii that mental health problems happen in our bodies, and that should be no surprise to any of us because we live our lives in our bodies. Like our life in this world is an embodied life. We feel our bodies, and we're feeling our bodies in different ways now that we're like not going to places we were before, and we're not around each other physically as much as before. And Nii, I'd love just to hear you talk at some point in this conversation about like what's going on neurobiologically when we're not with each other physically and personally. I think though that, that when we think about mental health challenges, it's important to have this both and perspective, that how we feel, what's going on in our emotions, in our minds, in our bodies has to do with things happening in our bodies, like the regulation of cortisol at any given time, and how our genes are working, and how things are happening inside our bodies, and that's really important. And mental health challenges have to do with what's happening in our worlds, in our relationships, communities, in our neighborhoods, in our Zoom chats, in lots of other ways. And so our experience is always at this interface, this intersection of our bodies and the world around us. So then as we think about like how to get help and support, I think that it's looking both, how do we care well for our bodies? What do our bodies need in this time? What does it mean to care for our bodies as like creatures of God, and to love our bodies as God does? And also to think about what's happening in our relationships and in our communities. So I think to get to the question of specific support, I think first of all, it's like, who in your community, who in your set of friends, who do you trust to go to when things are hard? And I think that all, many of us have friends and supporters and pastors and campus ministry leaders and others who we can turn to and who who feel we can trust, and that's really important. I think for especially if things are really hard and they're not getting better, and we're not sure where to turn, then seeking professional counseling, mental health help is really important. And any of you that are students at Duke and UNC can do that through the different services, even when we're not all together on campus, through the Duke and UNC CAPS services. And Duke has now done a lot. Duke at least has done a lot more in terms of online access of therapy recently. So talking with people, therapy can be really helpful. And also, I think if someone in the process of getting support is saying, you really should consider a medication right now because it could really be helpful for you through this time, I would seriously consider that, because that can be, as a support, as part of this broader way of getting support, of finding our way through this, that can sometimes be very helpful. But I think the key is not to be alone. If you feel like you're alone, then what does it mean to reach out and to let somebody else into that experience?
Mm-hmm. And just on the topic of medication, I know that sometimes that can be contentious in certain quarters, and especially in spiritual quarters where people think, well, if I use medication, then I'm not really trusting that God is enough. Nii, can you speak a little bit about, even from your own work and experience, on when medication might be appropriate and how people should sort through that?
Yeah, I can definitely speak to that. And just to reiterate some of what Warren has mentioned already, so you have talked very wisely about how the biology is integrated with everything that we go through. So even though we know there's a biological basis to some of these things, our biology still, as you mentioned, interacts with the world around us. And so that goes both ways, both when we're thinking about challenges that we have to deal with, but also when we're thinking about ways to address mental health challenges. So things just like being in community, that also affects the brain and can help us move through these things. Going through therapy also affects the brain. So we talked earlier about that amygdala response that happens when someone's in panic. If someone goes through exposure therapy or is talking with a psychologist, they can learn to use other parts of their brain, the frontal cortex in particular, which we think of in terms of planning and the higher order function, that can dampen that panic response. And it's the same thing with medication as well. So to get to your question, Michelle, that's another way that we can influence our brain. So we all have different challenges to deal with, but sometimes the therapy can be sufficient. Sometimes prayer can be sufficient. Sometimes we may need to also add on medication, but we shouldn't ignore any of the God-given tools that we have, that God's allowed us to be able to understand, develop, to deal with our mental health challenges. And I think it's unfortunately too narrow, although easy to slip into, too narrow to be focused on one particular thing alone. Mental health is not a one-size-fits-all type of approach. A lot of times there's a lot of different things that we have to think about, whether that's medication, therapy, whether it's prayer, or all these things integrated together to be able to get to a place of healing. And all of those things can influence our brain and how our brain interacts with the world around us.
Yeah, I would agree with that. And I like to think of, we sometimes can go wrong, at least we in psychiatry can start to go wrong with medication when we start to treat all of human life or the human body as a kind of machine. that needs to be fixed through like, you know, and psychiatrists can sometimes get into this way of thinking about like mental health challenges. It's like, well, you just need a little bit more of this medication to balance this system. And before long, you get into this language where all of a sudden it feels like the body's being treated as a machine that needs to be kind of tweaked somehow. And I think there are ways in which the body functions as a kind of machine, or at least as an analogy of a machine. But I think that often doesn't work real well with respect to mental health. And I like to say that we're not machines to be fixed, but we're wayfarers on a journey to be attended. We need companions, and we need those walking alongside of us, not like mechanics or, you know, technicians alongside of us. And so as a psychiatrist, I think our job as psychiatrists is to walk alongside those who are suffering and to think how can we help? But the key question, I think, is not like what's needed to fix the machine, but it's what's needed right now for the journey of this wayfarer who is on the way to God. And so in that way, I think sometimes the answer is a medication. And that is, I mean, so today I prescribe medications, and I think medications can be healing. It can be life saving in some cases, and certainly life preserving. But sometimes the answer is, you know, to have sustained conversations with someone whom you trust. And sometimes it's to get out of a abusive situation. And sometimes it's to have access to healthy food or a stable place to live. So those are all things that are needed. But I think insofar as medication is a gift of God, then we can embrace that and should embrace that.
Well, let me follow up on that just a bit and take it back the other way. Since we are whole creatures and this is all integrated, Nii, I wonder if you could speak to the biological impacts of some of these intangibles like social interaction, community support. How do those kinds of things actually help the biology that you even talked about at the beginning start working better?
Right. So that's a great question as well. And some of that we're still trying to understand as a field, but there are specific things that we've been able to look at. So I mentioned at the onset, a lot of what we do in our lab and other labs do as well is to look at the basic biology behind different mental health states and mental health challenges, particularly in rodent models, so in rats and mice, where we have them engage in behaviors that are at least reminiscent of what would happen in humans. So interestingly, if you have the rats and mice in isolation, they're much more likely, if you give them the opportunity to take drugs of abuse, they're much more likely to show depressive-like phenotypes and much more likely to show anxious-like phenotypes. But if you put them in community with each other, that changes aspects of their brain. It can change brain circuitry, it can change brain chemistry, and a lot of those changes are protective. So they're much less likely to take the drugs of abuse that humans will take, much less likely to have those pro-depressive and anxiety-like phenotypes. So there's evidence from that standpoint. I think we're in a really interesting state right now, since all of our interactions, or a lot of our interactions, are not in person. They're by video call, phone call, text. And there was one interesting study that was done in rats, just looking at, so this isn't exactly the same situation we're in, but the rats were allowed to see each other through a plexiglass chamber, but weren't allowed to physically interact. The one caveat there is they could still smell each other. So as far as I know, Zoom doesn't allow that platform. No one's cooking meals and being able to smell the aroma coming off of their neighbor's meal.
That's the next generation. So, you know.
Yeah, maybe that's an idea for someone to create. But even that type of interaction through the plexiglass was still protective for some of the behaviors that we look at when we think about mental health challenges. So there's definitely evidence of the interaction. Again, the interaction also affects our brains, which affects how we perceive and think about things and directly affects our mental health. So it's a great tangible example there.
Can I ask a follow-up on that, Nii? Because I'm so happy. It's such a privilege to have somebody who's like knows so much about neuroscience and about these things. So my intuition in these last few weeks has been that I think of myself as an introvert. I always thought that I kind of liked being alone, but I find actually that I'm really missing like physical proximity and connection to other people. And it feels like, although I've had a lot of connection with other people by Zoom, it feels like there's something that I didn't realize that I was gaining through just being in the presence of other people, from like being able to mimic others, you know, expressions and seeing that happen and being able to kind of resonate in a group of people. And it's felt like being totally online has made me realize that I didn't realize I was missing that. And I wonder if that's one of the reasons why everything feels a little bit harder now. Every mode of interaction feels like it takes a little more attention and effort. And I guess I just wonder, like, is that something that is, like, do we know the pathways for that? Or is that the case or not?
Yeah, I don't know if we know in particular, but I think we have enough hints that there are certain pathways in the brain that are important for those things. And some of that comes from literature that people have looked at in newborns, for instance. If newborns, again, in humans or in animal models, if humans have, or if the newborns have direct contact with the mother, if they don't have that contact, there are specific areas of the brain that are affected, areas that are important for emotion, areas like the hippocampus, the amygdala, as we talked about for the emotion area. And then also areas like the prefrontal cortex, which again, we allude to for this top-down function, but it also is deeply integrated with a lot of the emotional areas of the brain. So I think there is enough evidence that there are specific changes in activity, and that's especially important in development, but still when we're adults too, that can influence how we feel and how we are involved in different aspects of our lives. I would also say, even in what you were talking about, there is a lot of evidence for reward pathways in the brain being deeply important for aspects of our emotional well-being as well. And sometimes in states like depression, the reward pathways in particular seem to be affected. So when you see a lot of amotivation, people lose the will or the drive to be engaged in their daily activities. And those same pathways are affected when we interact with each other. So I think what you're hinting at is there's a lot of overlap in different pathways that are important in our interactions that also influence how we feel about ourselves, also influence how we go about goal-directed activities on a day-to-day basis. And so I think all of those things, this is a little bit anecdotal, but all of those things are being affected in this moment where we don't have that same level of reward that we get from being in physical contact with one another.
And just to follow up on that, I just this morning on NPR, they were highlighting another cost of the isolation being for people who are struggling with substance abuse, the support groups that are very necessary to their sobriety being disrupted and trying to figure out a way to replace that virtually somehow as best they can. What advice would you give students on this call if they themselves or friends of theirs were on the road to recovery from any number of challenges and find this moment they're on the verge of a setback? How can they help themselves or their friends chart a different path forward?
Well, yeah, I can go ahead and jump in. I think some of that we've alluded to already. And I'd say the very first thing is just acknowledging that challenge and saying it's okay for that to be a challenge in this season. There can be a tendency, I think, sometimes to carry too much weight and disappointment in that, or even get into a mode of self-critique, which is something that does come with a lot of mental health challenges. But I think in this moment, it's important to acknowledge that these are very extenuating circumstances. And there's going to be times when all of us are more challenged than before, especially if someone was already on the road to recovery. And I think the other things are the things we've started to allude to already. So being in community with others, being able to share that with trusted people in your lives to say that I'm struggling in this area, and being able to have those people step in for you in different ways, whether that's prayer, whether that's pointing you towards someone that you can talk to who's a professional, whether that's assistance in connecting people with their mental health providers. This is one thing we also allude to. I mean, a lot of things are moving towards telemedicine, but we also have to realize that certain forms of telemedicine are more difficult for some than others, just in terms of access to those services or comfort with those services. So I think it's important to just make sure people are connected to as many resources as they can get to. And I know some of those resources are going to be shared here tonight as well. The National Alliance on Mental Illness has some great resources. There's a crisis text line that people can reach out to. But again, I would say not being afraid to name that and being sure that we have this connectedness with our family members, loved ones, or those who care for us, and then also getting connected to the right professional services if need be. There's no shame in that whatsoever. And there's a lot of there's a heroic component to that as well, being willing to take those steps.
Yeah, and I would just add to that. I agree with everything Nii said, and I had a patient say to me today, like, I wanted to go to AA, but the groups are not in person, and so that's really hard. And I would say, in addition to community, which is just so central, connection and community as a resource against addiction is really important. But also, I think a question for all of us, whether we're experiencing some form of addiction presently or not, is how do we care well for our bodies during this time? So when our bodies are like crying out that they're not being cared for, then that's when we're vulnerable sometimes to turning to things that might bring a kind of momentary pleasure of some sort, but actually isn't good for us in the long run. And so what does it mean to care well for our bodies, to sleep, to eat, to exercise, to again, to treat our bodies as the good creatures of God that they are? That's not, a simple answer, but that's one component, I think.
That's very helpful. And, we kind of started this whole conversation thinking about the fact that these stresses are impacting us all. And a lot of us are having feelings that are more intense than we've known before. How do we know when we're struggling with whatever feelings those might be, when we do need to seek the help of a professional? What are the good signals to ourselves or to our friends that we really do need to seek some extra help?
I would say if you're wondering whether it's time to seek help, it's time to seek help. Like, you don't have to wonder too much about it. If you're wondering, that's a pretty good sign. And then if other people who are walking alongside you are wondering whether more help is needed, then more help is needed. So I think even the wondering, I think, is a good sign.
That's very helpful. Well, we've already talked about this to some extent, but I know any question of mental health is inevitably framed by our worldview because we're integrated humans. You can't talk about mental health without talking about our worldview and our view of what it means to be human. Nii and Warren, I know that both of you are Christ followers. How does that impact all of the discussion that we've had? We've heard a little bit of it already, but what spiritual resources exist for other Christians to apply to these challenges, and how does it help you as you're trying to help people through these issues as well?
Yeah, so I can go ahead and jump in. I think it's a huge component, again, just thinking about this in terms of us as whole people and in terms of thinking about our holistic approach to these challenges. So I think it's always good for us to think about that wholeness of who we are and where we can draw our comfort. So there's a certain power in prayer and meditation, just in knowing that something outside of us, God outside of us, can also intervene in these challenges in our lives. But there's also very practical pieces with that as well, in addition to God's supernatural power working through that. And some of that is some of the same types of concepts that often come up in therapy. So not taking all of the burden on oneself, for instance, but thinking about others who can come alongside you and aid you in that. So there's a lot of power in even just meditation in and of itself. So taking time to pause, taking time to breathe, taking time to reflect. And it can change the perspective in terms of how we think about these things. But I also think about specific scriptures where we're instructed to cast all our cares upon the Lord. So that's a beautiful representation of knowing that this isn't something that we have to carry in ourselves. We have God who can help us with it. We have others who can help us with these things. There's also verses that tell us to not to be anxious, but to present all our requests to God. And the peace of God will comfort us in those times, in those seasons. And so I think it's important for us not to ignore that, to know that there is a power there that comes, but also not to stop there as well. So if we're thinking of ourselves as whole people, God can provide us with that peace through his power, but he may also provide us with that peace, as we've mentioned, through other people coming and walking alongside us, through people praying with us. He may provide that through a therapist that's helping us walk through and talk through alongside us some of the challenges that we're going through, or helping us deal with a specific trauma. Or medication may help us get to a better place to even be able to talk through those things. So I would say we have tools at our disposal that God has given us, both spiritual practices, which are effective and which God works through, but all of these other tools as well.
Yeah, thanks for that, Nii. So I've been thinking about lament. Can I think about how lament might apply here?
Yes.
So I mean, if nothing else, this time I'm like saying this to myself. This time is a time when it is clear that we are not in control. And like, I mean, I have like 2 doctoral degrees. Like, I like to be in control. I like to find, and And yet right now there's this devastating virus that's sweeping the world, for which there's no approved treatment yet beyond supportive care, and no vaccine. And we're all like, thinking about it, and our lives are disrupted. And I think that that's pretty scary. And I think it's okay to feel anxiety and fear in the midst of that. But I think there's two things that we need to hold together as Christians, or at least that I find that I struggle, but I feel it's important to hold together myself as a Christian. So the first is that people are suffering and dying, and there's injustice, and it's not right, and it's not okay. And that's important, I think, to affirm. And the second is that the triune God is still Lord of heaven and earth, and still loves us, and still is in the healing business, and still here, and still redeeming. And it's really hard to kind of put those two together. I think if we affirm the first, that things are not okay, but we forget the second, then we either begin to lose hope, or we think that, like, if there's going to be any victory over death, it's got to come through our own efforts, which I think is where a lot of our culture is right now in some ways. If we fall in the second, that God is still Lord, but we deny the first, that we end up either like denying how bad things are, or we don't listen to the voices of people that are suffering, or even worse, we try to justify God somehow. And I think there's a biblical way through that allows us to affirm both together, and that's through this practice of lament that we see, especially in the Psalms. And I think a lot about Psalm 13 in psychiatry, but also I think in our time. So, it's a 6-verse psalm that starts, "How long, O Lord, will you forget me forever? How long will you hide your face from me? How long must I wrestle with my thoughts and every day have sorrow in my heart?" And then the psalmist goes on about, my enemies are going to destroy me, and I'm going to die. And the thing, and it's this very like gut-wrenching prayer that the psalmist is offering. And the amazing thing is that in this psalm, like there's no evidence that in the psalm itself, the psalmist experiences healing or deliverance or anything else. But then in the end, the verses 5 and 6 of this psalm says, "But I trust in your, God, unfailing love. My heart rejoices in your salvation. I will sing to the Lord because he has been good to me." So there's this things are still horrible in the present, but the psalmist knows that he's the part of this people of Israel that God has chosen for God's own, and that God will redeem, and that God won't forget. And he knows that because of that deliverance in the past, there will be deliverance in the future. He's able to and so in that way, the cry, this cry to God, "How long?" becomes a cry of faith. And the faith then in many ways enables the honesty of that cry. And I feel like that's where we need to exist as Christians. We need to be able to say, this is not right. It's not right that, a close relative of one of my students died this past week as a young man. And it's not right that racial minority populations are being disproportionately affected. And it's not right that we're seeing all this economic vulnerability. It's not right. And also, yet, it's not just up to us to fix things, and that we participate in God's healing. And I think then there's freedom that this is not the church's first pandemic. Christians have witnessed previous pandemics, and we can look at examples of Christians being faithful in previous pandemics. And there's freedom in knowing that in life and death, we belong to God. And so death doesn't have the last word over our lives. And there's freedom to pursue the work of justice, not because it's just our effort, but because it's God's work that we get to participate in. And so I think all of that can bring us freedom, but also can allow us to very clearly say, this is a hard time and things are not right. And we can affirm that as Christians, and that's okay.
Thank you.
And can I add just one thing there? So I think, Warren, you've really hit it square on the head with both of those things simultaneously, the injustice that's happening. And I think also everything you've been alluding to in terms of faith is the idea of hope. And there is an ultimate hope that we have. So even in the midst of everything that's going on, so in the midst of loved ones who have passed, who shouldn't have passed if COVID wasn't occurring, administrators of school systems, kids' classmates who've lost parents, those things should also outrage us and disappoint us, cause us to grieve and lament, but we also have a greater hope. And there is a lot of power that comes in that in and of itself. even if we took a step outside of our faith in Christ and just thought about that in terms of hope, there's a lot of evidence in therapy that when the clients have hope, that makes it more likely that they're going to move towards a place of healing for whatever mental health challenge they have. Now add on top of that, the source of that hope being God himself, and how much more powerful that is. And I think that's everything that you're alluding to, even in the unfortunate face of death, an ultimate hope for a life that's to come afterwards, and how important and essential that is for some of the tools that Christians have to really address these, which are still big challenges, but a hope beyond the challenges themselves.
Thank you. Yeah.
Yeah, thank you both. That's really helpful. We're going to open it up now to a time of questions from the audience. And what you're seeing on your screen right now are responses to the first survey question that you saw, which is, what one word best describes your emotional and mental health during this time? So you see the words that all of you entered on the survey. And I wanted to mention that in addition to the questions that you're able to ask now through Slido, Warren and Nii are going to be available for another Zoom meeting, breaking out from this one shortly after we finish. I think you've all had the experience of wanting to go up to a speaker after a meeting and asking that question that you didn't really want to ask in front of everybody else, or maybe you just wanted to ask it in a particular way. They wanted to have a space for that. It's not going to be completely private, but it's at least a space for a little more interaction around some things that might be on your mind. So you see on your screen now, if you haven't already, here are instructions for how to use Slido to ask your questions. And again, we just want to draw your attention to the support resources that are available for anyone struggling with any sort of mental health challenges or emotions that just feel like more than they're able to bear. As we get started with the questions, let's start with, you alluded to this a little bit already, Warren, but we were on the issue of health disparities. We have seen these really disturbing statistics. I think we're probably less familiar with how those disparities work themselves out in the way of mental health, and maybe both of you could speak to this, but especially clinically, what kind of access do vulnerable communities have to mental health resources, and what kind of stresses might they be under, and what could we do about it if we want to help?
I think either of us could take this one first, but well, I mean, mental health is, I mean, mental health challenges are universal in the population, but social, economic, historical factors that affect how people live and what opportunities people have absolutely affects lots of different mental health outcomes and domains. And so, I mean, these are, I mean, things like access to stable housing, access to stable food, safety of where one lives, safety in a home. All of these are really important. And I mean, it goes on and on. Access to healthcare, a community with a kind of intact community ties. All of these are really important for children and for adults and for really all of us. And so I think, you know, one thing that we're seeing tragically is that, you know, that COVID is, I mean, all of us, or almost all of us, are susceptible to COVID, but those who are having to work jobs where they're not in positions where they can be distanced, like, you know, most of my time now is spent at home, and yet that is not the case for people, a lot of people in Durham, where I live now, people who are in neighborhoods and contexts where, like, they are just at higher risk, people who don't have access to health care. I mean, all of these are significant. I mean, and underlying pre-existing medical conditions make the medical effects of COVID often more vulnerable. And so all of these overlap. And so I think you're seeing with COVID, the pandemic is unveiling deep injustices that are already present in our culture. Not that people who inhabit privilege aren't vulnerable to COVID, because I would count myself in that, we are. But it disproportionately affects those that aren't. And so my kids are in the Durham public schools, And, you know, they're at home and they're trying to make their way through like lessons. But I mean, there's a lot of their classmates don't have, not only do they not have like high-speed internet for Zoom chats with teachers and like, you know, devices, but they don't even have necessarily access to like food. And so like one of the things that's really been occupying the school district is how do we try to get food to families whose kids depend on this for nutrition? And I think that's what we're seeing now in this pandemic so deeply. Yeah, I'd love to.
Yeah, Nii, do you want to add?
Yeah, I would agree. I think you've highlighted a lot of the key pieces, and unfortunately, a lot of the aspects that make people susceptible to COVID are things that have already, as you mentioned, been there, and also making them susceptible to some of the mental health disparities that already exist. So, I mean, some of the recent statistics I know, even from Chicago. So, for instance, I think 50% of those who got COVID were African Americans, even though it's only 1/3 of the population. Same thing in Louisiana, even more so, unfortunately. So 70% of the fatalities were African Americans, again, when only 1/3 of the population. So a lot of it has to do with some of the aspects that Warren has already alluded to. But it also has to do with things like access to that care. And unfortunately, sometimes even the quality of the care. So even in New York City, as testing was being done, there were certain communities that had access to that testing first before other communities did not. So there's already going to be an inherent lag just because of the way the system is set up. And that's not something, unfortunately, that people themselves can do anything about when the testing is or is not made available in their community. So, I mean, it's a challenging question because it involves multiple tiers and multiple layers. Some of that is for all of us to do in our communities to be able to encourage people to be able to, again, some of the things that we talked about with mental health, to take advantage of the services. But then people also need to know where to go for those services and to make sure there's access to those services in the first place. So some of it is things that we can do, but some of it also has to be a systemic change from all of us, including those in government, those in policy and community groups, to make sure that access is there. Because sometimes, unfortunately, the quality of care can differ. There are some studies that have looked at how much money is spent on people's care, and that can vary by zip code or by ethnic background. So if two people come in for the very same type of ailment, one person, there's more money in the healthcare system that's spent on them than the other. So it's something I think a lot of us have to be willing to raise our voices about, to encourage each other to seek the services, but also to make sure that systemically and from a structural standpoint, those things are made available. So not an easy question at any level, but something that's going to take a lot of work on multiple levels to really address fully.
Thank you.
This is important now when everybody's focused on COVID, but it's going to be also important when we're trying to move on from COVID. Like there's this long tail, and it's going to be with us for a long time, I think.
Shifting gears a little bit back to the issue of social connection, especially when we're forced to isolate ourselves more than we were designed to be. Even pre-COVID, the New York Times columnist David Brooks was writing a lot about the importance of social interaction and communities and community cohesiveness. And I've heard him say that he's hopeful that the kind of interaction that people are having over Zoom can at least in part substitute, even though we lack a lot of those bodily features that you guys were talking about earlier, as long as it's deep and personal interaction, and that the quality of that interaction is really what will determine whether it's any sort of substitute for what we're used to in person or not. Is that something that, with each of your expertises, that you would agree, sets of expertise, would you agree with, or would you disagree? Like, how do you guys think about that? Nii, do you want to take that first?
Sure, I would definitely agree with that in terms of the meaningfulness of those interactions, as we've talked about, because that just influences how we go about our days. I mean, even not research-based, but even speaking just personally, you know, I think similar to Warren, I'd also consider myself an introvert and probably put more emphasis on alone time before than when I got into this moment. So, you know, even things like checking in with my students or staff in our Zoom meetings, sometimes for me, strategically placing those in the morning can be helpful because it jumpstarts my day in terms of helps me stay on a schedule. You know, one of the things that Warren also mentioned is just having a routine, saying wake up time, exercise routine, and having those meetings, but just being in the presence of other people seems to just perk things up in a sense. I don't know if this is the best comparison, but I can compare it to coffee in some ways too. The way I used to rely on coffee, you can have that same sense from just being in connection with other people, even if it's not in person. And again, those meaningful connections can activate those parts of our brains, the reward pathway in particular, that influences how a lot of our emotions and how we go about our day. So I would say yes, if it's meaningful, that can be helpful. Meaningful and creative. I've heard of people doing karaoke parties online and watching movies together. So there's a lot of different ways that meaning can happen.
Yeah, I mean, I'm kind of agnostic about whether Zoom can get it done in that way. Like, I think there's things that we lose when we're looking at screens, but I also have found really meaningful connections with people in this time, and I'm grateful for Zoom and for that matter, phone and other things. I do have this kind of intuition that communities that survive this time healthy are going to be those that really invest hard in keeping connection with each other and with those that they care about in their orbit, whether it's customers or whether it's congregants or something else. And so I think if all of the communities that we're involved with that we care about, if those communities aren't doing a lot of work to keep connection, I think they're at risk. But on the other hand, I think this is really an opportunity to really invest. What does it mean to connect to each other well in ways that are life-giving, and to feel the blessings of that?
That's helpful. What can we do? Here's another question from the audience. For those whose home is not a safe place, either physically or psychologically, and this is especially true for college students who may have had to go back home. It's true for younger students who are now with their families more during the day. What can we do to help in that situation?
I'll take that first. I really respect that question, and it is something that I know is happening, and so I think it depends on what unsafe means in part. I think there's some homes where life is unsafe, and or there's things happening in the home like intimate partner violence or like active substance use or really scary kinds of things. And in that case, I think that really is an emergency. And so if it's for instance, like domestic violence or intimate partner violence, then pretty much every county, or at least every region in the United States, has some nonprofit support agency that helps provide resources for what happens when people are trapped in really hard situations. So in Durham, it's the Durham Crisis Response Center. And there's other organizations that can also provide some help. But that in Wake County, it's Interact of North Carolina, and those exist in different places. So I think if it's life-threatening, it needs to be treated as a life-threatening emergency. If it's not life-threatening but still really hard or really unhealthy over the long run, then I think it just folds back into this is not the time to keep family secrets or to keep household secrets when really awful things are happening. Like, you need to reach out to others outside of that system and think, like, what are my options? What does it mean to stay safe? What does it mean to live here or not? Like, I mean, there's the different situations are going to be different, but I think seeking help, getting connection, it can be life-saving.
Yeah, I would agree with that as well. I mean, definitely challenging situations to be in. But as Warren mentioned, especially with the life-threatening, but if it's not life-threatening, if there are ways to get connectedness and to get plugged into other support networks, even in this time, I think that would be critical.
And this is a question for both of you. How does your faith play into the way you treat and talk to people who are anxious or depressed about this pandemic?
So I think for me, it gives me a place of compassion. Again, just thinking about knowing the challenges that people are going through, but also thinking about both the compassion that God has for us as his children and seeking to care for us. So in some ways, this forum itself is an act of that passion and compassion to make sure that people are equipped with the tools or have an understanding of what happens in the brain during these challenges. But as Warren is here as well, also having knowledge of what tools they can tap into I also say there's a level of privilege and responsibility for being able to have the time to be able to investigate these things in the brain, be able to share that with others in a way that's empowering. So I also talk about the fact that I feel like I have an opportunity to study God's creation and study neuroscience and all the beauty and intricacy of that, but then also have a responsibility to communicate that to others, to be able to share that and help people have an understanding of the things that God has allowed us to understand about the brain to bring people to a better place of healing.
Mm-hmm.
Yeah, I think for me, one thing is just to recognize that I'm in an incredibly privileged position right now. I mean, to be a psychiatrist at this time. I mean, I have a job and I'm able to do this work, and so part of it's just humility. Like, it's not like have all the answers and I'm like, dispensing it to other people. There's a lot that my patients have to teach me and my students have to teach me, and that's and I just have to remember that. I think one thing, there's a lot of ways to answer that question, but one thing that I've taken some comfort in is that early in the years of the church, in the first few centuries of the church, there were these plagues that would come through the Roman Empire. And I'm sure that Christians at that time in practice responded in lots of different ways, including, running away and retreating. But there was a subset of Christians at the time who, because they knew that death didn't have the last word and they believed in resurrection, like they were willing to be present with those who were sick with the plague, and they would bury bodies when the elites of the Roman cities at that time would run for the countryside, just like is happening now from big cities. There were these Christians that would stay around and would attend to those that were sick and would be present with them, even at cost. And so I think in some ways I don't want to make too much of this with me, but it just feels like, okay, now is our chance to think about what does that mean for our time? Not to take inordinate risks of like getting close to people and putting people at risk. And I don't mean that, but like, what are the opportunities that we have to be like our generation of people who are facing this really scary challenge? And because we believe in resurrection, and because we know that God loves us, and because that doesn't have the last word, and then life and death we belong to God, what does it mean to be able to be present to each other in this time? And I think it gets back to what Nii was saying about hope. I think there's that way in which nothing about COVID or about COVID's mental health effects or about anything that can happen can take away the fact that we're loved by God, can take away the fact that that Jesus is Lord. And I think we can rest in that. That's really, really important. So it's important for me then when I'm sitting in these situations with patients where things are just really hard.
That actually relates to two other questions that we've gotten. The first says, this might be too early to ask, but how do we, churches, healthcare providers, relational beings, prepare to meet the increase in mental health needs post-COVID? Warren, you were just mentioning, like, this is a time when we could make a historic difference. What would that look like in practice?
Yeah, I'll say one thing briefly, and I'd love to hear Nii's thoughts about this. I've been thinking recently about Jesus's healing in the Bible, in the Gospels, and also in Acts, really, and with the early church. And when Jesus healed, it wasn't just like what we consider now a medical healing. I think of these 3 R's that characterize Jesus' healing. There was reversal of disorder and decay. So that was like kind of what we think now, like, the body's like decaying and now it's coming back to life. And that's, so Jesus did that. And that's what we've kind of longed for with COVID. But there were these 2 other dimensions of Jesus's healing that were maybe equally important for what they meant for him, which was really the display of the kingdom of God. The second was rescue from hostile and oppressive powers. So often people would be oppressed either by their communities and their culture, or by unclean spirits, and Jesus would rescue them from those powers. And then the third was restoration to community and relationship. So Jesus, it wasn't just reversal of disorder and decay, but it was rescue from hostile powers, and it was restoration to community. So when I think of like an agenda for us as Christians, insofar as we have the privilege to even think in this way, I mean, we need to just, some of us are just struggling to survive. But I think insofar as we can think about like what are our opportunities now, it would be not just to like seek that, like how can we flatten the curve, although that's really important, but it's what does it mean over the long term to commit ourselves to rescue and to restoration, not as our own work, but as participating in Jesus's healing work. And that's where I think like how could we live our lives such that in the next pandemic or in the next economic recession or in the next whatever, that the kind of ways in which people are vulnerable now and made more vulnerable will be less likely. And none of us have the power to do that all ourselves. I mean, that's God's work and not ours, but we can participate in it. And I think that's our call as Christians.
Yeah, I agree with everything that Warren has said, just in terms of that framework itself too, and just thinking about all these important aspects of the rescue and then also the restoration. The piece I would add, which he also alluded to, is just the long-term nature of the restoration. So when the next pandemic comes, and I would even add that even within COVID itself, when there are pieces that last beyond what we can see with our eyes. So I'm thinking of people who unfortunately lost family members and loved ones and friends to COVID-related death. Those are things that are going to last beyond this. So as people go through their period of initial grief, but grief is something that will be revisited later on down the road. So not forgetting those individuals a year from now, when some of them might be feeling some anniversary-related grief, or even 8 months from now. So being willing to have a long-term view of stepping in. And then even as we talk about some of the mental health challenges, so some of the words that people have been using is a sense that in a way, as a society, we're all going through a collective trauma right now to different degrees, but this is something, it's a trauma that nobody can escape, because at some point, most of us are going to know someone who's either gotten the illness or passed away, unfortunately, from the illness. So trying again to think about what does that look like long term? If rates come down or if they spike again, what are some of the consequences that are going to continue to happen in terms of people's mental health? And how are we as a society being attuned to that and being ready to be there and to be available as community for those individuals? Again, maybe just spending time with those individuals, or all the things we've talked about before, pointing people towards professional services. I think for us as Christians, if we're really going to act out that love, it's being committed to that love for the long term and not just in this one isolated moment.
That's really helpful. And it's helpful to think forward like that, about what possibilities might exist for us to participate in making things different in the future. I think that's exciting and hopeful for me. Pulling it back a little more for folks on the call who really would love just 2 or 3 very practical tips that they can use for their friends who might be struggling, or just to maintain that sense of social connectedness, especially, Warren, as you said, Zoom it's something, but it's work. How can we try to maintain those senses of connection, and how do we try to help folks who may be struggling with the ways that that this experience is exacerbating whatever they may be feeling?
I would say that this might seem, sometimes people might feel like this is too structured, but I would say we should be very intentional about it and schedule it. So especially, for many of us, it's hard, good intentions can only go so far. It might take scheduling that, and especially at this time, with everything that's going on, with all the nonstop news about COVID, I think it's even more important that we are intentional in terms of scheduling that time. So thinking of those people in our lives, they can be easy to forget about if you get into a mode of all the worries that we all may be dealing with. Be intentional about reaching out to those people on a consistent basis. And that ties into everything that we've talked about so far, just in terms of how important that is for maintaining a good mental health state and for also dealing with mental health challenges, both in terms of our interactions and what happens in the brain. So I'd say just even as a first step, that would be a key piece. And Warren, I'm sure there are things you could add there as well.
Yeah, I appreciate that. I think I would echo that. I think all of us have a deep need to be known and to know that others are knowing us. And there's lots of ways to do that. So it's not just Zoom, it's also like email and handwritten letters and phone calls and things like that. So I'd just say this is our chance to kind of be creative and also to be playful in how we connect with each other. So like what would it mean I mean, just like be creative about how we can connect and what we can do. I think also just like showing up if there's groups that are meeting or other things, and you're wondering like, I don't know if I should participate in that or not. Like it's fair not to, but I think just, don't like make it a routine to show up for things that are opportunities for personal connection with other people.
And I'll add one thing there as well. I mean, this might sound a little bit trite. It's not meant to, but I would say part of it could just be as much as finding space to have fun. So because that also has an effect. So in a way, we talked about some of the neuroscience and the brain biology. I talked about, the animals being in community with each other, but you also see some of those same effects if you put toys in the environment. So if the animals have an enriched life of playing with toys, that is also protective against some of the mental health challenges. So for us as people, I think there's an importance for having space to have fun, having space to laugh. I mean, there's so much gravity and weight that's associated appropriately with COVID, but I think there also needs to be room for that joy and laughter of life that also influences our mental health and just gives us a relief and a release from all the tensions I think a lot of us are dealing with to different extents.
Yeah, that's great. That's a good word. The fun and the creativity are also often things that we lose when things feel so somber, but it can be so helpful. I think we have time for maybe one more question. There have been a lot of questions about, and you guys alluded to this a little bit, about a lot of students on this call are finishing up a semester. There was routine, there was structure that was abruptly disrupted. What role, and actually now classes are ending and soon, and then what for structure? So the question is really, what role does structure play in mental health, and how can students protect their mental health when they don't have the structure from classes and the schedule that they had when they were on campus?
Warren, do you want to jump in first on that one?
Yeah, sure. Either of us. Yeah, I just want to echo that. I think that's a real challenge. I mean, and at least the end of the semester over Zoom has still had the routines of like class times and certain kinds of things. And I think as the summer is always less structured, but often college students fill that with lots of busy things and trips and that kind of thing. And it's looking like the summer, at least the first part of it, is not going to be that way. And so I think planning for that is really wise, rather than getting 3 weeks into the summer and recognizing that like there's no plan. So I think like what, and that there's not going to be a one size fits all answer to that. But yes, routines matter. Even more than that, like meaning and purpose matters for our mental health. Connectedness to others in relationship matters. The sense that other people are counting on us for different things matters. And so I guess, again, this is the time to be creative. Like, what does it mean to think about, okay, we got to have not just a plan B or C, but like a plan F for June and July this year, because everything we thought in January we were going to be doing is going to be different. And so like, what are opportunities now? So rather than think about it as like a sense of fear, like, oh my God, it's going to be terrible, I've got to just make it through. Like, what are opportunities? And that might mean like a small group that might not have met over the summer before might meet, or there might be ways to think about, like it might be that a nonprofit really needs volunteers or needs like somebody to be active. I mean, there's lots of, I don't know, everybody's gonna have a different answer, but I would say be creative, but having a plan is probably pretty wise.
Yeah, I would agree with everything that Warren said. I mean, it's definitely a challenge and not easy, but I think there's a lot that comes from being plan-oriented about it and just thinking of creatively doing that. For those who are, artistically inclined, there could be a new output of art that's developed from this time, or, people who are into journalism may start writing more pieces. I mean, there's a whole host of different types of things, and even this Warren alluded to, just unique groups that could be started. But I think the routine itself is definitely the most important. Although the most difficult part I would anticipate would be coming up with some type of plan or plans A, B, C, and D to then try and implement and experiment with along the way.
Along those lines, have you guys heard or seen any really fun things that people have been able to do virtually, creatively, to enjoy one another, and even, as you mentioned, the clubs or groups that might be started? Or do you know where we might look for other people who brainstormed those kinds of things?
Well, yeah, I mean, the creativity, I guess this was about 3 weeks ago or so. I mean, there have been some DJs that have put on the house parties. I don't remember which one it was, but it had, 100,000 attendees. So, just little things like that that still brings in that fun and creativity. Yeah. People have talked about karaoke nights. I've seen some research groups do that. I proposed that to my research group. They weren't all that excited about it. maybe I have to take the initiative in that. But people have been having meals together across the country. I've had groups that I've been involved in that just gotten together for lunchtime meetings once a week, just to be able to, not even with any agenda in particular, but just to check in with each other and just see how everybody's coping, just to have that time to talk. So yeah, lots of different ways. Music that people are doing online together. So I think that this again opens up the opportunities for creativity in that.
Yeah, I think these Zoom concerts are really cool. Like I've been seeing. So yeah, beyond me, but I'm sure that others on this call are doing that already. So yeah.
That's great. Well, it's time for us to wrap up. I wanted to ask if either of you had any closing thoughts, things that you wanted to leave everyone with, or just wanted to make sure got said tonight.
I've said this earlier, but to be on with Nii is really fun, and we've been known each other for a while and have interacted in different ways, and it was really great to be here with you, Nii. So thank you, and thanks to all of you. Thanks to you, Michelle, and thanks to all of you who are taking this time in an evening to have extra time on Zoom. That's really an honor.
Right.
So,
yeah, I would just say I'm really thankful for the opportunity. I would also just like to just applaud the bravery of those who are going through mental health challenges and are still staying engaged in the struggle and staying engaged and trying to make sure that it's something that is not ignored, but that they're able to pursue in terms of moving to a better place of wholeness. So I'd encourage those folks to keep going on and to know that your example will also be helpful to others down the road who will see you walk through that and look to you as a source of hope for ways that God's been able to help someone move through it. So I just encourage people to continue in that way and to continue to move through to a place of wholeness.
That's great. Well, thank you both. This has been really fun and really helpful. And I really appreciate your time with us tonight. And I hope you both have a great evening. I want to thank everyone that joined us tonight. And I wish you all well as we all continue to experience this pandemic together. Good night.